One of the hardest things for me was being able to openly talk to anybody about my constipation. It isn't a user-friendly piece of conversation, for one thing.
Linda Ropke is typical for those who have chronic constipation.
Second of all, people are, I think, put off, not knowing what to say, think you're some sort of a nut, because everybody can go to the bathroom. I mean, it's a very common day occurrence.
It's something she's been both suffering from and seeking treatment for since childhood.
I think I was born chronically constipated. It's just been a constant, overwhelming, getting worse type thing as the years went on.
For the hundreds of thousands of Americans who have to cope with it on a daily basis, chronic constipation is a horrible disorder that invades a person's everyday life and often renders them downright miserable.
But most of the time, this is just the way a person is. Most of my patients describe difficulty since childhood or certainly since adolescence.
Dr. Charlene Prather is a member of the gastrointestinal department at St. Louis University. She's a recognized expert in chronic constipation.
Now, there are a variety of ways to define constipation. Everybody has their own idea about what that is. But when we refer to constipation, we include symptoms such as bloating or abdominal distension.
In Linda Ropke's case, pain was a large part of her ongoing bouts with chronic constipation, complete with the more typical symptoms of bloating as well.
Sometimes the abdominal pain was like having a knife being sort of cut crosswise and just wondering what is going on down there.
As the years went on, Linda grew very skilled at dealing with it, thanks in large part to a healthy diet and an active and energetic lifestyle. But that wasn't enough to solve this chronic problem. But at the age of 50, Linda's battle with constipation was about to change. As an executive assistant in the internal medicine department at St. Louis University, she had heard about a certain doctor on staff who was studying chronic constipation.
I went down to the 9th floor and literally barged into her office and said, "Could I please take a minute of your time?" I felt embarrassed, I felt humiliated, I didn't know what to do. I sat there for 5 minutes and I told her my story.
Well, of course, whenever I see a patient with constipation, the first thing I like to talk about is diet. Honestly, most of my patients with chronic constipation, they've tried the dietary fiber path. However, just the same, I want to make sure they're on a good, healthy diet, getting an adequate amount of fiber. The American Dietetic Association recommends at least 25 grams of fiber per day. Most individuals in the United States get in the range of 12 to 14 grams of fiber, so there's usually some room for improvement.
It's important to screen for other possible causes for constipation. Metabolic conditions such as problems with the thyroid gland need to be ruled out. Also, it's important to confirm that the condition is not caused by any medications the patient might be taking, or by more dangerous problems such as colon cancer. It was a simple test called a colon transit that helped Linda and her doctor finally begin to solve the problem.
The colon transit is just a very simple thing. You swallow some pills that will show up when you get an x-ray 5 days later, so they can see if they're still in you or if you've passed them. In my case, I think 90% of them were still there.
For Linda, just knowing that her chronic constipation was real and to have the rest of the world know it too was a genuine relief.
Dr. Prather has given me a new outlook on life. She has completely changed my life around. She has made me realize that I am not just out there by myself. There are many people suffering with this same disorder. I am not unique in that, and it's good for me to know that.
Certainly for those with more long-standing symptoms, I may try a prokinetic agent, an agent that helps move things through the colon.
In Linda's case, it was this new type of prokinetic agent that finally began to turn her problem and her life around. Prokinetic agents are medicines that can cause muscles in the GI tract to move food through the digestive system.
Today I'm able to get up in the morning and carry on a normal work day without having to give thought to what kind of a stomachache do I have. How bad is my abdominal pain?
Well, I think it's important to let your physician know that you are troubling with constipation and to think about what are the symptoms that are bothering you most. When it's impacting one's life, that's when they should see their physician and get some treatment for their constipation.
The greatest advice I have for women today is to be their own best advocate. Know how you feel.
Okay.
If your pain is anywhere near as severe as mine was, and you feel cramping, stomach ache, abdominal pain, bloating, please see your doctor, seek medication. There are things that can be done. We have sat back for a long time and just accepted this pain. We don't have to do that anymore.